Excited today to host Dr. John Chang, Medical Director of the Oklahoma Proton Center on the Cancer Project podcast. Fun fact about Dr. John Chang, he's known as one of the best radiation oncologists in the country, but he's as well known for, and maybe more so, for his skills on the pickleball court. No. So tell us a little bit about, this is kind of a new passion for you, pickleball, or maybe it's not. Maybe you've been playing pickleball for a long time.
No, I haven't. It's just another way to try to stay in shape and trying to play a sport that me and my family are very competitive, so we just like to do things and compete in any avenues, and sports are one of the things. My oldest plays hockey, so I play a little hockey. My younger one plays water polo. I can't swim with a lick, so I'm not a water polo player. And then we try to play all sports. So pickleball is just kind of a way to kind of stay in shape. I feel like even though as I get older, I can still kind of play that. It doesn't require a ton of moving around.
So I remember, so Dr. Chang and I have known each other for a number of years, and you spent a good part of your career in Chicago, which we'll talk about in a little bit, and then did a year in Vanderbilt. And then when we took over the Proton Center in Oklahoma City, we targeted you, for lack of a better word, to come and really lead the revitalization of that facility. And there was a lot of ideas that we had about upgrading equipment and opening new protocols and expanding the types of patients that we treated. And I remember we hired you, and then shortly after you got to Oklahoma City, I think you had to get a hip replaced.
Yeah, that's right.
Is that accurate?
Right. Yeah. So
what happened?
Well, so I started playing hockey in my 30s, and being that I did not keep my flexibility up as a kid to be able to play hockey in my 30s, I really must have destroyed the hip joints. So actually in Chicago, I had my right hip replaced. And by the time I got here, I realized that the right hip was probably the worst, but the left hip was just as bad. And so once the right hip was fixed, the left hip basically, became so painful that it was hard to walk. So pretty quickly I realized I had to have my hip replaced. And so I did that here. So now I'm bionic and,
right. Yeah.
So it's been tremendous, and, been able to recover from that. And I'm back to playing hockey, and, my wife comments how ridiculously stupid I am for going.
I thought you were going to say ridiculously agile or more athletic than you were before.
It's like, why do you still traumatize yourself like that?
And you play goalie?
Yes. Yeah.
What, have you always played goalie?
No, obviously when I first started out, I just tried to learn how to skate and do those things, and just playing like a normal player. And then my oldest was at that time about 7 or 8 years old, and he wanted to play goalie. So I started trying to figure out how to play goalie to try to help teach him, but he basically far exceeded me and ended up playing hockey at Michigan. So he basically, as all kids do, exceed their parents in almost everything. So now he actually is, working as a software developer in New York, but he also is one of the head assistant coaches at Columbia University.
Oh, really? Okay.
Yeah,
that's fantastic. Yeah. And so tell us a little bit about your family. I think you have 2 sons, and then you're from Chicago. You grew up in Chicago. So what are your sons doing now?
So my oldest is in New York City. He is a software developer for Baxter. He actually is working remotely, so it's not that he has to be in New York to work at Baxter, but I just saw an opportunity to be in New York, and lives in the Westchester area. The younger one actually just moved to Boston, and he took a job at Siemens, and so he's working there, and they do have a facility in kind of the suburbs of Boston, so they're now both on the East Coast. So I actually grew up in Michigan, in the Midwest, and I went out to University of Pennsylvania for my training. And when I was on the East Coast, I realized we weren't kind of East Coast people. So we came back to the Midwest, but we enjoyed the kind of the big city aspect of being out in Philly. So when we came back to the Midwest, we came back to the big city in the Midwest, Chicago. So we've been in Chicago for 25 years. And so we still make our home in Chicago. As you know, I keep flying and commuting basically back and forth from Chicago to Oklahoma City. So I go home on Fridays, come back on Sundays, and it's really kind of worked out very well. My wife now in Chicago, she used to show dogs all the time. We had Grand Champion Bulldogs, and then she kind of retired from that and now enjoys her second love, which is jewelry. So she works in a jewelry store for one of her friends and loves shiny things. And so that's very compatible with what she wants to do right now.
So your wife shows bulldogs. You play hockey and pickleball.
Yeah.
Both very competitive. Would you say that your wife is more competitive than you, or are you more competitive than she is?
No, I think
or is it about the same?
It's about the same.
Yeah.
I mean, we strive to win at everything. So no, and it's all about just trying to do your best at everything, right? That's kind of been the our philosophy. Our kids are the same way. They're very driven, and it's all about trying to do your best and to try to make the best of every situation.
Tell me a little bit about the dog showing process. I think you've done some pretty big shows.
Yeah.
What is that process like? Like, what do you have to do to get to the point where you have a champion bulldog?
Right. So the way it kind of worked out, it was kind of serendipitous because we've had dogs for over 20 years before we started showing dogs, and we always wanted kind of on the bigger size dogs. And so we had mastiffs, we had boxers, and then it just got to the point where my wife said, you know what, these dogs are just way too big. Let's get a smaller dog, but with a big dog mentality, because, you know, really small dogs are a little yippy and they're a little hyper. So a bulldog is kind of like a big dog and short legs. So we just got one as a pet. And then, so as we were, you know, kind of, keeping in touch with the breeder, they bred show dogs. And then, so in the end, when it was about time for my youngest to finish high school, the breeder came up to us and said, hey, you know, since, you know, John's working all the time, said to my wife, John's working all the time, and, you know, your kids are going to be gone to college and away. Let's get you another career path and have you show dogs. So we got our first show dog from our breeder of our original pet bulldog. And that's how it kind of started. And our first bulldog went all the way to Grand Championship. He was 5th in the state, or in the country, actually. And then we went to Westminster with him as well. And then we started having his offspring become champions. And we had one of his daughters who then became 3rd in the country and also was shown at Westminster as well. So it really kind of fed into my wife's competitive nature to show dogs and win. But eventually, it just became a little cumbersome. And so, you know, she kind of decided that she did her time with that. And now she's showing jewelry now.
And what does the life of a retired dog champion look like?
It's awesome.
Pretty luxurious.
It'd be nice.
Yeah. We could all hope to get there someday.
Yeah. Eat, go to the bathroom, go to sleep.
Yeah.
I mean, that's
Pampered,
pretty nice.
Driven around the country. Yeah,
exactly. Yeah.
So I want to shift gears a little bit. I think you have a really fascinating background with your family that kind of led into you deciding to become a doctor. So tell us a little bit about your parents. I know you were born overseas, and just what it was like growing up for you, Dr. Chang.
Yeah. So it was really a very inspiring story as I was growing up, as I heard more about it, you know, as I started to understand where their background was. So both my parents came from mainland China. Mm-hmm. And so they were kind of in the central part of China. And during the revolution, when the communists were taking over, my mom basically escaped from China to Taiwan with her whole family. But my dad, actually, interesting enough, he was about 14 when that was happening. And his father told him, you really need to leave. This is not going to be good when the communists take over. And so he basically ran away from home, joined the Nationalist Army, which then got basically ousted from China, and they all ended up in Taiwan. So that's how my parents ended up in Taiwan and met there. And so it was very inspiring, mainly from my dad's perspective, in that he basically raised himself. From age 14, he was raised by the Army, essentially. But what he told me was that his first thing that he wanted to do is he wanted to educate himself to the point where he could eventually go to America. And so what he did was he bought, when he finally got enough money, his first purchase was a Chinese American dictionary, and he would rip pages out of it. And as he was marching, he would actually memorize. And just to fathom somebody doing that at age 14, 15 years old is just amazing, right? So to me, it was like, I could never even live up to that, no matter what I did, right? So I always strove to do my best because of what he did to get himself to where we could come to America. And, he brought us over, we immigrated legally, and then, we became citizens. And, that was, to me, very inspiring. And then, it has actually inspired my kids hearing that story to kind of work hard in their own respect. So.
And so when did you come over from Taiwan to America?
I was 5. So as he came over initially he got his degree in Taiwan at military college. And then he came over and did his master's degree in Michigan. And then he brought us over after he was graduating with his master's degree. And then, we kind of started our life in actually downtown Detroit. So it was kind of hard at the very beginning. And he worked 2 jobs. My mom worked 2 jobs. Like he was a busboy and delivering pizzas in downtown Detroit. So
with a master's degree.
Yeah, with a master's degree. And we lived in some of the harshest parts of Detroit, got our cars and apartment broken into multiple times. So, we really had to kind of work our way up. And, again, it just kind of helped our drive with.
Well, and I think I've heard you say this before, that upbringing and what you saw with your parents, and then even what you talked about growing up in Detroit, there's a little bit of this mindset of nothing can faze you. Mm-hmm. We're going to overcome any challenge. And you've applied that to your approach to cancer care. Mm-hmm. You are, when I see you interact with patients, you always take a very optimistic approach with patients, which is no matter how bad the diagnosis is, we are going to do everything we can to try to tackle this. And I think that optimism from you, which partly stems from your upbringing, manifests itself to your interaction with patients. So I don't know if you would agree with that assessment of kind of how you approach medicine, but I've observed that with the way that you interact with patients. Yeah.
I mean, I think it's a mindset that for me, I always look at the possibility of helping them. And sometimes I talk to them. I'm not going to sugarcoat anything. Mm-hmm. I'm going to tell them what the reality is, but I'm also going to tell them that if there's any chance, we're going to go for it. And if they're in the same mind frame or same mindset and goal driven like that, then I'm happy to help them get there, right? I'm also happy to help them try to be as comfortable as possible. Mm-hmm. I mean, that's the other goal too, is that sometimes we can't achieve cure for every situation. But my mindset is, okay, if that's not the case, then let's improve your quality of life for the time that you have. And so that's also one of the things that I think is also very important as well. So those are the kind of, avenues I try to take. And I think a positive mindset always helps, in addition to the science and all that. But I think that helps patients to focus on what's important and not regress. And then when they have that mindset, they're more apt to try to stay nutritionally fit, try to stay active. Those are the type of things that do help the mind and body.
So tell me a little bit, because you mentioned a couple of key words there, which is cure and quality of life. Mm-hmm. And I remember, again, when we first started working at the center in Oklahoma City 6 years ago, you came up with this slogan, or I guess you told me that you maybe heard it from a mentor at UPenn, more than a cure, quality of life.
Right.
And I still use that today to describe our approach at the Oklahoma Proton Center, which is we're not just focused on curing your cancer. We also want to ensure that you maintain this quality of life during and after treatment. So talk to me a little bit about where that came from and what that really means.
Right. So that when I was in my training at the University of Pennsylvania, one of kind of the key founding members of radiation oncology, especially for kids, was Dr. DeAngio. And I had just the huge honor of being one of his mentees, as he was kind of an emeritus professor at University of Pennsylvania. So he always talked about the fact that as he was coming up through his training and through everything that he was doing, that he realized that, you know what, it's not all about just driving for every last bit of, chance at cure. It's also about preserving quality of life, especially for kids, because, especially because he was a pediatric radiation oncologist, that he wanted to make sure that he could provide quality of life, not only right now, but also in the future. And in kids, your impact on them at that very moment will translate into the rest of their lives. Mm-hmm. So his one key statement that he imparted to me was, cure is not enough. Quality of life is just as important. So that has been the drive of, what I want to do on a day-to-day basis. And so, using technology and delivering treatment that not only has the best chance of cure, but also minimal impact on the rest of the body has been key to what I strive for.
Mm-hmm. So, and I think that's amazing. And I think it really speaks to the approach that we should take in the oncology community today, especially with all of the tools and resources that we have at our disposal. I want to step back a little bit and tie in with your time at UPenn. Tell me why you wanted to be a doctor, and then maybe tell me why you settled on radiation oncology.
Yeah. So that backtracks all the way into kind of my teens, when I was kind of trying to figure out what direction I was going to take with things, right? It's still early, but one of the most impactful things was that my grandfather on my mom's side, he developed lymphoma. And when he got lymphoma, they were in the Houston area. And of course, they went to MD Anderson, right? So I was in Michigan with my family, but I would come down to visit my grandfather, and, he would be going through all these treatments. And one of the worst things was that he had such bad decrease in his white cell count that his teeth were starting to get infected. And so he had to have all his teeth extracted. And he was going through chemotherapy and all that. And at the end of it, he still passed away from his cancer. And it was just so horrible to see him go through all that, have his teeth removed. That was kind of, to him, very humiliating, having just basically no teeth. And also the fact that they couldn't make dentures for him because he was so sore in the mouth. So it was miserable for him. And, my thoughts, kind of coming away from that was that, we have the best cancer center in the whole country or world even, and they still couldn't make his quality of life better and couldn't cure him, and that's the reality as far as the cure, but, that he had to go through so much suffering and still didn't come out with a good outcome. So that really kind of inspired me to, okay, at that point I realized I want to do something in cancer going forward. So initially in college, my drive was to do cancer research. Mm-hmm. So I worked in a lab, and that was through my sophomore and junior year. And in that lab, I was working actually fortuitously in a not a physician's lab, but a researcher, a cellular researcher who worked with radiation oncologists. So there would be experiments where they would take cells and they would radiate them and do different experiments in that conjunction with that. And there would be physicians who were training in radiation oncology at Michigan who would come into the lab and work in the lab as well. So they, would work with me and I would work with them. And they were like, let me show you what I do in the clinic. And so they brought me in there, and me being a very gadget tech kind of guy. I walked in there, I was like, oh, this is paradise. Now I can use the latest technology to do the thing that I want to do most, which is help people. And so I was never kind of going in the direction of being a physician. I really wanted to do the kind of the bench work, the laboratory bench work. And then this drove me in that direction. And also I eventually realized the bench work was really boring.
Yeah. Right. Yeah.
But my wife started and did that for most of her career before she became mom and things like that. So she found a love in doing that. But I really enjoy the interaction with people.
So then, so you were at University of Michigan and you did a medical degree at the University of Michigan and then residency at UPenn.
Right.
For those of you that may not know what it means to be a radiation oncologist, explain what that is.
Yeah, so a radiation oncologist is someone who treats cancer with radiation of different types. It can be radiation seeds or radiation sources that you place into patients, or it can be giving radiation from the outside to target cancer. Right. We also treat some benign tumors as well, but our goal is to use radiation for health benefits, basically.
So you do the residency at UPenn, and now you're the medical director of the Oklahoma Proton Center.
Right.
So you're using protons a lot to treat cancer. Did you know about proton therapy at UPenn?
Yeah, we did actually. Right at the end of my residency, they were starting to look at protons as a treatment modality more commonly. It was already at that time a very small niche field, because at that point, the only two proton centers at that time was Loma Linda University in California and Harvard University, right? So the two kind of coast areas. And it was just because the technology was so expensive to build. And so University of Pennsylvania was looking at building their proton center, but in the end, it was still over 10 years away. So I finished residency. I knew that protons was kind of on the horizon. And so when I went out to Chicago to join the practice there, I started to kind of look into trying to somehow create a facility like that in Chicago, right? A big city, lots of patients who would benefit from it. We started looking at that. So initially, at about, I would say 2003, 2004, I'd have been in practice for about 3 or 4 years. I started to reach out to places who were looking to build proton centers already. So MD Anderson was kind of the next place. And so one of my attendings or mentors at University of Pennsylvania had gone to MD Anderson to become an attending there. So I reached out to him to see, how they did it there. I was in contact with one company who was trying to present a way to do it. And then I found another company who were looking at that as well. And, that's the company that started building proton centers, Procure, that was looking initially here in Oklahoma City, the facility that we're currently in. And then Chicago would be the second center. So we were able in 2005 to come up with a way to build a proton center in Chicago. And 5 years later, in 2010, is when we got our proton center. And then this facility opened, I think, 6 months ahead of us. So that's how we kind of got protons on the map in Chicago and here in Oklahoma.
Yeah, the Oklahoma Proton Center was the 6th proton center in the country and opened in 2009.
Right.
Yeah.
Yep.
So at that point in time, late 90s, early 2000s, you're talking about proton therapy. In the late 90s, it's Harvard and it's Loma Linda. There's probably not that many patients getting treated. It's kind of this nascent field within radiation oncology. Why were you so interested in proton therapy?
Well, it's exactly like I was talking about, our drive to provide treatment for cancers and minimize the collateral damage, right? So just looking at the kind of the science behind it, because protons is a particle as opposed to just a beam of energy, we could send that particle in to hit what we wanted to, but then we could stop it before it just goes all the way through, right? And much like a particle or a bullet, basically, the entrance energy is not really giving off a lot of energy to that tissue. So where it stops and collides with the tissue is where it does the most damage. So by doing that, we start to realize that, hey, we're going to have something that basically damages what we want and minimizes any damage to the other tissues, which kind of is the pinnacle of what we can do with radiation. So that was the drive to start to, push for this technology to help other people.
And talk to me a little bit, because you mentioned when you were at UPenn, one of the things that your mentor talked about, and I know you've had a lot of experience in this field, is pediatric oncology or pediatric cancers. Tell me a little bit more about what it means for a pediatric patient to get proton therapy versus traditional radiation. How does that impact their quality of life? Or maybe what are some examples of how recovery or life 5 or 10 years after cancer can look different for pediatric patients getting protons versus traditional photon radiation?
Right. So for pediatric patients or children, as they're growing, their bodies are developing, right? Their cells are, forming from the initial type of cells and maturing into the adult cells that you have the rest of your life. So in that process, if you damage them, they will be irreparably damaged for the rest of their lives, which means that there are consequences of what you damage at that point for the rest of their lives, right? And so what we've seen is that, let's say we treat brain tumors and that damages or slows the development of the brain going forward. We've seen that patients can have a lot harder problems in school going forward, even holding a job in the future. And using protons really translated, when we did the research, that they had less IQ deficit with the proton therapy as opposed to regular radiation. One of the biggest things that we always worry about is low and medium dose radiation that can come from the regular radiation hitting other tissues, which it doesn't exceed the threshold that maybe causes damage, but that low and medium dose radiation can sometimes cause mutations, and mutations are what cause second cancers. And so what we used to see is a high rate of second cancers in kids that we'd cure, but the second cancers usually take about 8 to 10 years to form. So we wouldn't even see that kind of manifestation till they were in their teens or something like that. So those are the type of things that we really wanted to mitigate. That's some of the studies that have been done to show that the protons really make a tremendous difference in kids, not only to their normal tissue and their development and eventual kind of function going forward, but also the chance that the treatment might cause a second cancer. So all those things are critical. And that's much less of an issue in adults because their bodies are mature and developed, and the cells are a little bit more resistant to the damage when they're older.
So when we talk about more than a cure quality of life, there's really a substantial, noticeable impact for pediatric patients because they're still developing. So it's very difficult to see a child come in with cancer at the Oklahoma Proton Center. And we've treated a number of kids, and you've treated a lot of kids in your career at Vanderbilt and up in Chicago and during your time at UPenn. What is your approach as an oncologist dealing with the impact of seeing this child walk in with cancer? How do you mentally deal with just the weight of the fact that you have this child that's going through something so challenging, and then it's impacting their siblings, and it's impacting their parents, and it's impacting their entire family?
Yeah, it is a challenge because you are not just treating the patient, you're treating the whole family, right? So it's important to kind of focus on seeing what you can do for them, the practicality of how, the treatment's going to affect them. I don't want to say it's the great thing about treating kids, but kids are very resilient, and a lot of the treatments we have nowadays are very effective for kids, and that pediatric patients really have a very high survival rate in a lot of the diseases that we treat for them, leukemias, some of the brain tumors, things like that. We impact them very successfully as far as, cure. So that's the great thing about it. We want to make sure that we keep the family focused on those type of things. It's important also to kind of treat the family as well, right? So it's important to kind of keep the parents, kind of positive and focused and know how to treat their child and not to kind of over pamper the child. Sometimes there's a tendency to do that. And what happens there is not so much that the child suffers from that, it's the siblings, right? Mm-hmm. The siblings then start to feel like they're not as important as the other child that's sick. So we want to make sure that they stay focused on all those things. And so it's really good to have a social worker or some type of support for the family. So not only treating the patient, but also treating the entire family as well.
So I know recently we've had a young boy get treated at our facility for a brain tumor. What do you tell a kid who walks in and it just says, "Doctor, what's going on?"
Yeah.
What is happening right now?
Well, he had such a great attitude, and a lot of times what you'll want to do is to try to characterize what's going on in a way that is kind of, he actually had already come up with this thing where he called his tumor slimy. Mm-hmm. And I said, okay, well, we're going to knock slimy out of there because we don't want him to hang around anymore. Right. And so it's really trying to spin it in a positive way as far as how we're going to fight this and how we're going to help him fight it. And we have such a great staff that really know how to interact with these patients and families, and really kind of bring the best out of everybody. And for me, it's not that I enjoy treating kids. I'd rather not treat any kids and not have them have cancer. But it's just so satisfying seeing these kids down the road. Yep. So I've had a ton of patients in Chicago who still reach out to me. And actually, it's actually one of the best things that ever happened about a month ago, where my wife was working in the jewelry store, and there was a kid who I treated who lived in the same city that I live in. And the mom and the daughter came into the store and said, "Hey, are you Karen Chang?" And so talked to my wife and said, "Well, this is so-and-so. I'm not going to give names, but so-and-so, your husband treated him or treated her, and she just graduated from college and she's got into med school." And that just when they told me that, it shook me. It was just so satisfying to hear something like that, she was actually the first child I treated in Chicago. Wow. And so, it was overwhelming.
It reminds you why you do what you do.
Yeah. It's just like,
I meet these kids at this point in time where they're going through the most difficult thing that they've ever gone through, the most difficult thing that the family's ever gone through. And I'm here to try to provide them a little bit of hope and obviously try to deal with the issue, the cancer. But then, to get to see those pictures down the road is amazing. We, at the Oklahoma Proton Center, we've treated quite a few international patients. And I know you guys did at your time in Chicago. And we do a patient graduation every 2 weeks for the patients that are finishing up treatment today. But we actually have a family from England that's coming over for patient graduation in a couple of weeks, which is it's just amazing that they would take the time to come back and that the kid's doing really well. And so it's really rewarding, but it is still, I get choked up anytime I see a kid walk through the facility. So one of the interesting things about the process with treating a pediatric cancer patient, I think this is helpful for people to understand, is that part of what we have to do is decide whether or not we have to use anesthesia to treat that patient. So talk a little bit about that approach and what we may have to do with some kids to actually get them through treatment and what we were able to do with this young boy that we're treating right now. Yeah.
No, so we oftentimes, it's hard for even adults to hold still for, half an hour, 45 minutes, those things just for scans or something like that. But to imagine that we have to hold a child still to make sure that the treatment is accurate and precise and not going to hit anything that we don't want it to hit, and make sure it hits what we're supposed to design to target. We want to make sure that precision is very high, right? And so for a child to hold still during that time is very challenging, especially when they're around the ages of 10 or below, right? And so this child who we were seeing was billed as he's got to have anesthesia, right? And so while that is something we can definitely do, we can definitely provide that. We'd like to do it without anesthesia, mainly because if a child needs anesthesia, they can't eat or drink until they get their treatment and do the anesthesia, which means that typically they're not eating all morning until they get their treatment. And typically we like to treat them in the morning so that they only have to stay asleep and not eat during the time that they're asleep. But if they have to wait at all through the day, then, we all get angry when we're hungry, right? So it's something that it's hard to explain to a child that he can't get to eat or drink or anything like that beforehand. So if we can do it without anesthesia, that makes all the difference in the world. So what we really do is do a lot of play therapy with these children to kind of show them that nothing's going to hurt them when they get their treatment. All they have to do is hold still. We have different tricks to help them hold still, playing music, sometimes playing a video, those type of things. And we were able to kind of walk the child through it, get them comfortable with their positioning. We even sent the devices home that they would be laying in. So this child had to wear a mask because we're treating the head, and he would go home and practice at home, and kind of made it a little bit of a kind of a fun task for them to do. And in the end, he's doing great. He is, as he's going through this, he's, very much enjoying working with the team. Of course, he gets some rewards after the end of it. Of course, positive reinforcement always works too. So, but yeah, it's just been a great way to kind of help kids get through and kind of reduce the fear of all this.
Have you seen his mask?
Yes, I have.
Yeah. So tell me about the mask then.
Well, I don't want to give too much away. So
or maybe talk about what we do with masks at the Proton Center. Yeah.
So we have one of our staff members whose wives is an artist, and she is able to create these wonderful masks. So it's almost like she can customize the mask to make it like a Halloween mask of whatever the child wants. So they'll express their desires, whether it's a cartoon character or animal or something like that. She can actually create that in stunning detail. And so the child then becomes almost like kind of role playing and pretending they're somebody else. And for them, that's sometimes enough to get them through the treatments.
They're a superhero. They're a princess. Exactly. They're putting on their mask.
Yeah.
And it's really neat. And I think, we've treated a lot of pediatric patients at the Proton Center, and you've treated a lot of pediatric patients, and there's things you learn over time about what's going to make the child comfortable, what's going to make the parents comfortable. But one of the things that I would say is that everybody up at the Proton Center has such a heart for those kids, and will go out of their way to do anything and everything to make the experience there just a little bit more comfortable. I remember we had a patient that we treated a few years ago, and you'll remember this. He was very interested in becoming a fighter pilot. Yeah. And so at his graduation, when he finished treatment, we arranged to have some of the pilots from Tinker Air Force Base down the road show up in full attire and then dress him up as a pilot to celebrate him finishing treatment. And it was just really neat to see what that meant for him.
Right.
What are some of the other stories that you remember from treating pediatric patients?
I mean, a lot of it is what really sticks with me is when they come back, when they're much older and it's almost hard to recognize in them, and so for me, it's just been tremendous. And also a lot of the international patients that they still keep in contact. They tell us their updates on their successes and things like that. So that's what's so rewarding about that. I do want to kind of, also kind of branch off a little bit and just say that it's not always about the pediatric patients too. Our staff, I think this is what I feel about our staff, and a lot of, the staff that I had in Chicago as well. But the protons, because the staff is working at the Proton Center and they feel like this is cutting edge, it's a technology that makes a difference. To them, they feel like they're making the difference and they take so much pride in what they do. And I think they're really inspired to work there, right? So that to me is what creates the environment that these people are working in, and they basically continue to foster that.
That's it. I love what you just said. I think that's a great point. They're empowered knowing that we have this incredible technology at our disposal. And so that inspires them to also say, let's meet that level from a patient care standpoint. Not that they wouldn't otherwise, but it's just nice to know that we're going to provide the best patient care possible while also providing access to the best technology possible for patients, which is going to generate the best possible outcomes for patients. So a couple more questions, and we're really fortunate because this is actually going to be a two-part series with you. You've agreed to spend a lot of time with us. I guess you don't have a pickleball game tonight.
No.
And so just a couple more questions, and then for part two, we'll dive a little bit more into the clinical benefits of proton therapy and just approach to different disease sites and how that all works. But stepping back, bigger picture, what for you is the most challenging part of being a radiation oncologist?
Yeah, I mean, it is. So stepping aside from just the proton aspect of it, it is really justifying what we do. When we talk about treating cancers, it's always a multidisciplinary approach, right? So it should always be that when you get the diagnosis of cancer, your doctor should basically present your case to surgeons, radiation, chemotherapy doctors, all the support staff, as well, because it should never be one-dimensional in your approach, right? So our challenge as radiation oncologists, a lot of times we're not the ones who make the diagnosis. So a lot of times we have to justify using radiation or not in certain situations. So as a radiation oncologist, I really try to stay up on all the studies that are done, both from the past and also currently, to make sure that I still stay up on the cutting edge, because we can never stay stagnant in treating cancer. We should always keep trying to find the next best thing to help patients. And that's what I feel like with protons, that is the next evolution of how we can do better for patients. Surgeons, they do better by now doing robotic surgery, right? So they don't have their hands in patients. They have these little basically fingers and prods and things like that are robotically controlled, so they're steady. They cut less, damage less tissue. Same with what we're trying to do is hurt less tissue. They're trying to damage less tissue physically when they go after this. And now with the chemotherapy or medical oncology doctors, they are using targeted therapies where they actually not just trying to poison the body, which is what chemo usually does, but they're using immunotherapy where they're directing drugs only at the cancer cells and really minimizing any exposure to other things. So I think all of medicine is really trying to improve that kind of therapeutic ratio, which means maximizing cure, minimizing side effects. And that, I think, is where we're going with things.
So part of the challenge for you is just staying up to speed on the rapidly evolving field of oncology and all of these different treatments. But it's something that I know, talking with you on a regular basis, it's something that you're really good at. And I do love the fact that you mentioned that you do try to stay up to speed on what medical oncology and medical oncologists are doing and what surgeons are doing, because it really is, it takes a team to effectively treat cancer. So what are you most looking forward to over the next few years as a doctor or just as a field of oncology?
Yeah. I mean, I think that we are evolving in trying to, again, continue to progress in delivering the best treatment with minimizing side effects. And I think there's a higher level of precision that we can get to. And so I think that's what we're trying to strive to do. Cancer is really it's multifaceted. It is not just one disease. It's not one entity. Every cancer is different, and that's why we need different solutions for every cancer. And so there's not one magic bullet that we have. We really need to, like you said, work as a team to kind of find the best strategy for each patient. And so that's why it is now what we call precision medicine, and we individualize care with precision medicine.
That's great. Well, I really appreciate your time today, Dr. Chang. One of the best doctors in the country that I've ever met. Last question for real this time.
Okay.
Perfect pickleball serve. Are you going up to the net or are you playing back?
Well, when you serve in pickleball, you have to serve. It has to bounce on that side and has to bounce back to you. So you always have to stay back after you serve.
Oh, you don't get to run to the net.
No, not right away.
See, and I'm not a pickleball player. So I've learned something today out of all of that. The thing I've learned, you serve and you have to stay
wait.
back.
You have to wait and then,
or Coach Chang will yell at you. So yeah. Well, that's good. Well, thank you so much, Dr. Chang. And we're looking forward to part 2, where we dive in a little bit more on the clinical benefits of proton therapy and what some of the disease sites are that proton therapy are really beneficial for. So thank you again.
Yeah, my pleasure.
If you've enjoyed what you've heard today, subscribe. We're on multiple podcast channels. If you have questions, you can leave those in the comments. We always try to answer those. Or if you do have specific questions about proton therapy, give us a call at the Oklahoma Proton Center. We can connect you with Dr. Chang and he can get all of those questions answered. Again, thank you for joining us today.